And we are live. So Dave, Kittle, Tony Maritato, Jimmy is going to be up in the air at some point here, so he is not with us today. Dave, how's it going, man? What's the weather like in New York right now?
It's beautiful. It's 67 right now, high of 80 today, but nice kind of like pre-fall morning. So how about you?
Yeah, same thing. It's beautiful. It's sunny. We're like mid 70s. I've been running so much, just taking advantage of like the coming fall weather. I think I developed some shin splints. So
Oh,
I might need to take.
do you know anyone who could treat that?
I don't, man, because I don't believe there's a treatment for it. The treatment is rest and nutrition. So that's what I'm going to do. I'm taking today off.
There you go. Good.
All right. So I grabbed a couple of screenshots from some Facebook posts that I thought would be interesting to talk about. They kind of fall into your area of expertise. But before we hit that, do you have any thoughts or topics or anything that's been on your mind?
So one was something you and I were messaging publicly on I almost said YouTube,
Yeah.
on LinkedIn about selling or the possibility of selling out of network practices or solo versus staff.
Yeah, let's talk
That's
about that.
let me just tease this for the audience. So that's one thing. Another thing I had sent you guys last week was, should practices have a irritable client price or tax? If you wanted to not surge pricing, I know there's a certain amount of ethics around pricing and all that, but let's just say if a practice had someone who was a little rude or moderately rude, how do I know you probably will just say, I'm not the right fit, and you'd probably refer them elsewhere. But let's say a practice didn't want to necessarily refer them elsewhere, but they also wanted to potentially capture some extra dollars, some extra value. Is that right? Is that okay? That's another thing. That's the second thing. Third thing is that I recently got a trial sample of Perfect Packs with some supplements. And I just about to open them today, and I was able to, for free, get a trial pack of, like creatine and melatonin and some AM and some PM supplements. And so my question to Tony is that first of all, should physical therapy practices do that? Should they sell that? Should they upcharge it? This is like a white label, this company, they white label it. So I could charge whatever to my patients and clients. They have like a base amount to cover. Should physical therapy practices consider selling supplements like that? And what's the liability if the client gets, irritable bowel syndrome, I don't know, whatever. Do they, is the physical therapy practice on the hook? Do they get in trouble? If so, Tony's going to say, "Stay away from me. I never want to do it." Uh, that's just another topic. And then any of the screenshots that I didn't even get a chance to look at yet.
Yeah, that's awesome. That's a great show. I'm going to put it out there. One other thing, if we have a couple minutes at the end, there was a dental practice that sued a person who started posting negative reviews. It was a client of this dental practice. I just heard the preliminary information, and the dental practice sued the person because they were posting negative reviews and
So
probably took it a little too far.
defamation, or we'll get into it.
That's what I'm assuming. Yeah, defamation. But all right, let's go back. So let's talk about, let's say it was a week, 2 weeks ago. I had shared a post on LinkedIn where I said, look, just give it up. Stop fighting for something we don't want. We don't want to fight for low reimbursement. We don't want third-party payer reimbursement. We don't want all the regulation and the burden and the compliance that comes along with low-paying third-party reimbursement. I said, just let it go. Let the hospitals have it. Let the corporate physical therapy businesses have it. They are built to deal with that. They have legal departments, compliance departments. They have venture-backed funding that will pay for all that stuff. And they have the risk tolerance. I can't risk Medicare or some other third-party payer coming back and saying, hey, we want 10%, 20% of all the payments we made to you because you had 10 or 20% deficiencies in this documentation. I don't want that kind of liability. So then some of the comments that came along with that post, one theme of the comments was, well, if you don't build an insurance-based practice, you don't have value. You don't have something that you can resell. You don't have something that somebody's going to want to buy. And I totally get it because I've said the same thing myself. The thing is, now we live in a world where even if I built an insurance-based practice, which I have, it doesn't have any value either. It doesn't have something that people want to buy. But for this conversation, we wanted to go into, okay, can we build a cash-based practice that has resale value? How do we do that?
Yes, absolutely. The owner ideally should be out of treatment or not be fully involved in the majority of delivering the core service. They shouldn't be involved in, everything. How do you do it? Doing what I'm doing. Like I'm treating like one patient, two patients a week, like very basically no caseload. And I'm trying to continue to set up other systems all in Google Drive, setting up this playbook. And the playbook is basically like if I get hit by a bus, a robot, Tony's massage robot could come in and run this business and know exactly like here's exactly the post and the images that we post for organic, attracting organic potential physical therapists on LinkedIn or whatever. And here's the new client paperwork, and here's the emails that we send out, and here's every little thing in a playbook. So that's one thing that I think most practice owners are not doing. Either they still love to treat and they want to continue treating. Maybe it's a little bit, maybe because they're probably great at treating. They love it. It's fulfilling for them, and that's fine. But to have something that's sellable, you have to it has to transfer value. Like the value has to transfer from how it currently is to another buyer. Basically, like without you in the mix. Like that's when it becomes more and more valuable. And that's the conundrum for physical therapy practice owners because they want to be treating patients, they want to be getting outcomes, they want to be known in the community. They are the go-to person, like go see Tony, not go see Total Therapy Solutions, but go see Tony. So if that is how it is, that could be a challenge. I like to, I'm basically out of treatment, but I will then send emails, send handwritten letters, that type of stuff. Eventually, like it needs to not be coming from me, but I want to stay in the mix a little bit of like the patients because we're doing mostly home visits. So, or even in the office patients, I don't always see because I'm not always in the office. So, um, getting out of the vital roles is how a practice or any type of business has the highest resale value. And it's, physical therapy is no different than if you and I were going to buy an HVAC business or I don't know, a landscaping business or whatever, like plumbing, it literally doesn't matter. So if it's almost, that's why you said before, Tony, that like buyers that are not physical therapists that come into the physical therapy world are oftentimes more savvy because they're not attached to the core service. They don't even know how to do the core service. They don't know how to evaluate and treat patients because they didn't go to school for it. They're not licensed for it. And they often can have more of a focus on how to like improve the practice, and they could buy a practice and then they could improve it for 3 to 5 years and then they could sell it to somebody else.
Yeah, I've shared this before, but back, I think it was 2000. So we started the business in 2001 into 2002. I think it was 2003. We were growing. We had tons of money coming in, but we were killing ourselves. We were working every patient, every visit. I'd come in at like 4:30 a.m. because I had realtors that wanted to work with me at 5 a.m. And then I'd stay till like 7:30, 8 p.m. because I had other professionals that wanted to come see me after work. And when I say we, it was myself. I was not a physical therapist when we started. Most people know that story. The person who was the physical therapist wasn't my wife at the time. She's now my wife. But the idea was, we were just running ourselves into the ground. We had tons of money, but who cares? Nothing to do with it, nothing to spend it on. But we had no kids, no family, no real commitments. And so we said, we cannot do this for 20 years. Like we have to figure out the formula to turning this into a real business. Because at that point you would call it a job. We invested $32,000. We went through the consulting route. We learned how to turn everything into a procedure. How do you answer the phone? How do you empty the trash? How do you turn off the computers? And that was really what gave us the skeleton, the framework to step out of the business. Then we could start hiring. We could start growing the business that wasn't dependent on us. Now, my question to you, so I would still say third-party reimbursement basically takes a business that would have, 4,000 customers a year and gives you 4 customers a year. Humana, MedMutual, Blue Cross Blue Shield, United, right? Throw in Medicare and Medicaid in there, you got 6 customers. So it does simplify things in one respect, but you pay a big premium, you pay a big price for that simplification, because now those big customers that are going to represent all of your patient referrals, they're going to have their own unique demands, and 25 years ago, we had higher reimbursement. We were able to handle those demands. It's harder and harder today. So my question to you is, if we're looking at the procedures that run a business, the frameworks, the systems, what are like 2 or 3, in your opinion, of the most important? I'll start. I think the most important is, how do you find and recruit clinicians? Like, it doesn't matter how good or bad they are. It doesn't matter how many referrals you get. It doesn't matter a bunch of the other stuff. One of the core operating kind of procedures in a business, cash or otherwise, you need staff. You can't sell services if you don't have staff. You need a way to find and recruit staff that fit the culture, fit the mold of what you're trying to build. So I would spend time trying to understand, okay, how am I going to recruit? How am I going to attract? How am I going to compete against higher paying operators in other, hospitals and skilled nursing facilities, home health? What are some of the other things that you would look at to say, okay, this is really an important procedure for a business to be successful and have resale value?
Yes. Well, initially, years ago, I was more focused on the marketing. I was obsessed. I was customer first. I was client first. Whatever, we live and die by the marketing and them, and they're more important. And what I've learned a little bit more recently in the previous most couple years is being more employee focused and employee first. And so, yes, part of what you said, I 100% agree with: the recruiting, the hiring, the onboarding, but then also if that's 1A, 1B is the retention of those therapists. I think you kind of hinted at it, but I know that's kind of what you mean, like finding great talent, finding great team members, and then retaining them. So if you have therapists that come in and they only work for you for 3 to 9 months at a time, and then they leave and they churn out, that's a big challenge. You're always going to be on the hamster wheel of hiring, similar to the whole new patient marketing hamster wheel. So yes, the most important, Sturdy McKee says the most important thing in a physical therapy business is initial evaluations. Because if you don't have evaluations, you don't have follow visits, you don't have the plans of care, you don't have a full patient schedule built out, right? And so you kind of reverse engineer from that, which would be like, well, how do you have initial evaluations? Of course, you need the new patients calling in, but you also need the licensed physical therapist to actually perform the evaluations, to have a calendar that's open, that's available to do the evaluations. So it's kind of like new employee recruiting, interviewing, hiring, onboarding. If that's like 1A, 1B is actually retaining them. So whatever it is with like coaching, support, mentorship, clinical education, journal clubs, giving them, ask them what they really want, ask them what they care about. Like you said this also before, Tony, like, do they care more about money? Do they care more about PTO and flexible schedule? And, like, those types of things will go a long way. And another therapist that works in a hospital, like if they want to, leave early on some days or come late on some days or whatever, like a hospital schedule is going to be very rigid, and you and I could be a lot more adaptive to those types of therapists. Like if they have, childcare issues, they get a flat tire or whatever, like those types of things can certainly go a long way, right? So retaining staff is, maybe 1B. Then right after that, 2 would probably be the new patient marketing. And I mean, of course, from there is everything else, like the processes and having everything documented and all that. But those are kind of like the foundational few that would begin the foundation of a practice that you can then build on for the eventual resale value that we're talking about.
It was interesting. Yesterday, I was listening to an interview with a YouTuber and then a couple guys that just do Facebook ads. And so it reminded me of Will Boyd. We had Will Boyd on the podcast multiple times. He switched from all organic to all paid ads. And one of the things that were interesting that they said was they need to manage capacity. Now, I think they were into retail sales. They did ads for big companies. Crumble Cookie was one of the companies that they worked with. And they said, the beautiful part about paid ads is when you need customers, you turn it on. When you don't want customers, you turn it off. And we know from therapy, like one of the biggest barriers is managing lead flow. We get new patients, trying to get those new patients on the schedule when you're busy, that's a challenge. So I still don't feel like I understand and have cracked the code to running effective paid ads. That's why you do it really well. I do it horribly. I can get a ton of organic traffic, but I cannot run an effective paid ad campaign. And I'm really trying to buckle down on that. I really want to work well and figure that out because I feel like that's such an important component. And I love the idea because we also hear the downside. The downside of paid ads is once you turn them off, you have no customers coming in, So for me, organic, I get a ton of organic traffic that costs me nothing and brings leads, brings things, but I don't have the control like I would with paid ads. And Hilda said PT burnout continues to be an issue. Some PTs have chosen to do part-time clinical, part-time sports PT. Would there be other pieces of advice that you could recommend? We'll talk about burnout in just a second. So back to, I think the same marketing strategies and understanding marketing that you would use to attract the right patient is the same kind of infrastructure you would use to attract the right PT. And to Hilda's comment, let me see if I can put it up here. I haven't been in charge of the back end in such a long
live
time.
stream. There we go.
In terms of like this, so, marketing, understanding how paid ads work, how targeting works, how the algorithm works. If we wanted to attract a sports-based PT, this having that skill set is important. I would say more important is knowing how to attract the right PT than it is knowing how to treat the patient. Because, I just think you can always find PTs to treat patients. You don't necessarily have the ability intuitively to attract the right PTs. Does that make sense?
I agree 100%.
So let's talk about burnout real quick since Hilda brought it up. I still think the biggest contributing factor to burnout is just being forced to treat the wrong people. Being in a setting where you have to treat everybody who walks in the door no matter what, no matter whether they want you to treat them, no matter whether they want what you have, no matter, their personality. This will be a segue into the personality tax, we'll call it, where, you were in a situation where there was an individual that just the personalities didn't jive, like they weren't a match. I've got patients like that come into my clinic, and what I do is I intentionally split them between my PTA and myself. I took 2 challenging personalities recently because before that, a lot of the challenging personalities went to my PTA. I took the last 2 challenging personalities, but then the 3rd challenging personality that came in the door went to my PTA. Because I was like, my docket is full. No more room for challenging personalities. So we're in a third-party payer model. I can't charge a premium. Obviously, you can. So let's talk about that experience.
Real quick. So how, like, the Gallup poll from last year, from 2024, the State of the Global Workforce Report. We're talking about burnout, but we're also talking about just either disengagement or I don't dissatisfaction, unsatisfied employees across the country.
Yeah.
62% of employees globally, not even domestically, excuse me, globally, 62% of employees globally are disengaged. 15% are actively disengaged, which would be your purposefully disengaging from your work, which would be 77%. So how is that? So I'm stepping out of healthcare for a second. I'm talking about this is global
Yeah.
and this is across all industries. This has to be part of the problem. This is not just healthcare. I pulled up something else separately, another blog that said the top 5 most burned out industries in America in 2025. Of course, okay, yes, healthcare is number 1, but then education, right? All the teachers that are doing great work that are, not recognized, or they're underpaid or whatever. Hospitality, so servers, waiters, hotel workers. Number 4, construction, the construction industry. Number 5, IT. So those are some pretty big and prominent industries, and it's not just healthcare, even though healthcare is number 1 on this list. But let me ask you again, Tony, 62% of workers across the entire globe are disengaged, meaning they must have something that they don't like about their job or something. I think that's the bigger conversation. I agree with you that maybe the healthcare thing is therapists or employees are being either they're being forced to treat patients they don't want to treat, or if you're in a hospital system and you're having more and more roles and responsibilities and tasks added to your plate when you didn't realize that was the case when you signed on and joined, or I don't know. But whether you want to talk about and answer just directly about
Yeah.
healthcare, Tony, that's fine. But this, I think, is the root cause of, like, how are 62% of global workers across every industry, how are 62% of people disengaged? Are we meant to not work? I don't understand. Like, it's crazy.
No, I think we know. I think we know every human needs work, needs something challenging, needs something productive, needs something that has a meaningful impact. I think in our core, that is a fundamental part of life, is we need something to challenge us and to work toward. Now, I think that, and I don't want to sound like the classic boomer or Gen X, but I
Come on,
also think
give it to us. Give it to us. Give it to
we
us.
have to understand, like, what are young people being told? What is the expectation? Like, I don't think I'm gonna go with the benefit of the doubt. I just don't think younger employees, older employees, I don't think they expect everything to be amazing all the time. But on the flip side, we're talking about subjective judgments. It's like, this is hard. Well, what the heck does hard mean? Hard is a very subjective word to use. I hate when somebody says something's not fair, something is hard, something is whatever. There's zero objectivity in that. And what I want to look at is, okay, where's the fulfillment you're looking for? What are you expecting? And then when that doesn't happen, what do you do next? And that's the question. So you get a job as a physical therapist. Why? Because I want to help people. Okay, you get there, you realize a lot of people don't want your help. They don't want your help at all, or they don't want your help in the way you want to help them. You want to do manual therapy, they don't want it. You want to do exercise-based functional therapy, they don't want it. Whatever the thing is, now you're sitting on a decision. What do I do next? So Hilda was saying, okay, we move out of, home health, skilled nursing, we move out of these environments, but maybe we can't find a full-time position doing what we want to do. So then you say, well, I'm going to take a job that's going to pay me a ton of money. There was a post that I had ready where somebody was saying, I love outpatient ortho PT, but I'm thinking about going into home health because there's so much more money, so much more flexibility. And you kind of say, okay, look, I know I need to afford a lifestyle. I'm going to do this for the money I want. And on the side, I'm going to do this to fuel my passion, to do the things I enjoy. The people that I want to treat, delivering the service that I want to deliver, it's just not that valuable to the people I have available. So I'll take less money, but I'm going to put on my big boy pants and I'm going to go get a job that pays me what I need to make to support my family and my lifestyle and the other things that I want. But I think if you go in thinking, well, no, I want to get paid $150,000 a year doing the things that I want to do, the way I want to do them, the time frame that I want, plus I want work-life balance, plus I want all of these other things, that's where you're going to be disengaged. That's where you're going to be, frustrated. You're not going to have the alignment that you're looking for. But that's a personal decision. It is totally your choice to get frustrated, remain frustrated, because you're choosing not to do the things that move you toward your goal. Okay.
Yes. Yes, it is your situation. If you're burnout, find a different situation, right?
Yeah,
Maybe need to change jobs, maybe need to move states. I don't know. But if you stay in that situation and complain on Facebook groups anonymously, I think you're a little bit part of the problem. I think you're just feeding into the group think where now you just start, shouting what other people are shouting.
yeah, I never understood. And I get it. Like, yes, there's family, there's other commitments that are going on, but there's always options. Even if you just take your clinical brain outside of healthcare, like you were kind of referencing, there's so many other things that we can do. The skills we developed as a therapist roll over into everything, even from, plumbing and electrical to what party planning, like taking your clinical knowledge, taking your ability to identify a problem, develop a plan to solve the problem, and move the customer from where they are to where they want to be. That would apply to every single other profession out there. And so if people are willing to pay more for you to be a party planner, then go be a party planner to make the money. And then you can still treat patients on the side as a hobby.
Another thing real quick, we'll wrap it up. The Gallup poll of 77% of employees are disengaged at work. 70% of the variance in team engagement is due to the manager. So if that's part of the problem, you find a new manager. And if you talk above, if you try to go above the manager and, the management's like, well, they're a good clinic director, they're a good manager, and they're treating patients, so they're productive and whatever, then you might just have to leave the company. You might have to go find another job if they're not going to change the manager. If the manager is not going to change or, improve or lead differently or, change how they're managing you. If that doesn't change, then yes, you have the ability to look elsewhere, go on LinkedIn, ask clients or ask colleagues what else is available out there, probably nearby, probably in your town or city, maybe a little bit further away. Maybe it's a state or two away, but there's a lot of great opportunities out there. You have to just go look for them, but please don't go into Facebook groups anonymously and continue the chant.
I saw you appreciated my call out of the anonymous person who is
Yes.
like, hey, I'm thinking about going into business. I want you to tell me who your customers are, how much you charge, what you get paid. Like, it was like 5 direct questions for pretty personal information about business, and they want to ask it anonymous. I don't care. I don't generally mind anonymous posts, but that one was so over the top.
Yes, you called it out, and then they got mad at you. There you go.
Yeah. Which after they made their comment, or I don't remember what it was, I don't think that was a therapist looking to start their own business. It was somebody doing market research on something.
Yep, definitely.
So anyway, having crappy managers is nothing new. That's gone on since the beginning of time. The whole function of a manager is to kind of squash creativity, to move the business toward the average. It always works against the best. It always protects the worst. Like, when you get to a size of an organization that actually has a management team in the middle, it's not the kind of thing that's going to support and promote you as a, innovative individual. But I had crappy managers. And like you said, like, the reason why I went into business for myself was because I knew I could get better outcomes. I could be more creative. I could build the business that I wanted to build outside of working for a hospital. But hospitals and larger corporate, they're always going to attract a certain type of person, and the most successful in those organizations are never going to be the most successful outside of those organizations. It pushes toward mediocrity, and that's what they were designed to do. All right, what was the second topic you had? Because that was another really good one.
The supplements, the pill pack thing, or was it the
What was the other one?
we talked about transferring value, selling, practices. Oh, the if you have a rude prospective patient,
Yeah. Let's go into that.
charging them a I called it something different privately. I'm sure you don't want to mention that, but I said like a rude person tax. So if you get a rude caller, they want to do business with you because they were referred by a very big physician or hospital group, whatever, and they're like, we heard about you from so and so. So it's not like they're just picking anyone.
Yeah.
They called you for a reason. They're like, you were referred by so and so, and yeah. So do you want me to tell the story, or you want to just kind of go into like what you would do with this type of a personality calling in?
Well, I want you to kind of give some context, but I'll go a little bit here. Just like with pricing, so you could go the route of saying, hey, this is surge pricing. When competition goes up, when more consumers want a limited service, you raise the price. Like that's standard market dynamics across all of history. But if you call it surge pricing, you're going to get hammered on social media. So you can't call it surge pricing. Instead, you say, this is our price, but we're going to discount the slower times. We're going to give you a 40% discount, 50% discount if you choose less popular times. This is something similar. So when you have a high maintenance, complex individual, and when I say complex, I mean they expect more than the typical customer. It's not that you're
Right.
charging them more, because that would be unethical and that would be bad. It's that this is our premium pricing for somebody who has the needs of somebody like you, and everybody else can get discount pricing because they don't have quite the standard that you have. So that would be my approach to something like that if I was in a
Oh,
cafe.
you know what? I think that's a great idea to use, like, let's say on a future phone call, I could use that. Okay, I could use the higher dollar amount as a price anchor and be like, well, do you have these expectations, and do you need us to, you're out of state and you're calling for your son or daughter. That happens all the time. Or it's you're out of state and you're calling for your mother or father, right? It could be the parent sometimes is calling for a 20, 30-year old
Yeah.
as an
Which
adult.
which
Sometimes.
first that right there is a red flag. Like
Yeah,
that right
exactly.
there.
Exactly. It typically is a red flag. It is typically continues to be a red flag. Um, Sometimes the family is calling the adult is calling for their mother or father who's 60, 70, 80, and but the son or daughter is out of town, out of state, and they want weekly notes and things to be sent, and sometimes there's like multiple family members. So it's someone who's calling in that's 50 or 60 years old. They're calling in for their mother or father. But then there's like, their brother or sister. So sometimes it's like two or three people in the mix. And it's like a group text or it's a group email. And they want, notes sent weekly or whatever. So yes, I could say to prospective patients today, if you don't need any of that, like that cost, and if you want, we can get into some of the pricing that I pitched. That costs this, but it doesn't sound like you need all that. But I'm going to say it to you, Tony. I'm going to say it to you over the phone and say, this
Yeah.
is how much this costs. You hear it. It actually would be a price anchor. We price anchor anyway. We price anchor by saying the weekend visits are a little bit more expensive and the weekday visits are a little less expensive. Weekend visits are premium, and weekday visits are this. Um, so I could potentially say that dollar amount on every single phone call as a price anchor, and most of the time, folks are not going to pay that because what I sent to you guys is the highest that I've ever charged ever. And we can get into some of the details of why and what else, what other expectations. But part of the story was the parent was calling us to get a portable treatment table purchased with their card, not my card, purchased with their card, and then sent to the home in Manhattan. But it's a walk up, like a brownstone, so it's not, there's no doorman or anything like that. So it's not like I could just have it shipped there. And then the client wants someone to kind of like bring the treatment table inside, walk it up the stairs, set it up, whatever, and have it ready for when my therapist actually is going to be doing the visit. So of course, you could use TaskRabbit type folks for that. You could have your physical therapist do it and pay them for that. But that's kind of the situation. And from this phone call, do you, as a little cliffhanger, do you want me to go into the pricing? I'm happy to disclose it.
Yeah. I think that's what people need to hear, because they will not believe it in most cases.
Yeah. So because of pattern recognition and hearing some of these things on the phone call, and what the actual part of the decision, one of the decision makers, even though the patient is an adult legally, I said, well, yeah, so we have a concierge fee of $950 per month, and then it's $550 per visit. Now,
Nice.
that is for this case, and now we're going to call that, you're helping me call that, like, that's like our standard pricing now, is what we're on the fly. You're
Right.
helping me say this is our standard pricing. If you're outside of New York City or San Francisco or Chicago or, I don't know, Miami or something, I know those dollar amounts sound insane. I get it. I can't even believe they said yes. But then again, I did Google the family, and I was like, oh, okay, yeah. They have very expensive homes that are on Google. Let's just put it like that. So I
So
was like,
real
oh,
quick, let's pause right there a second. Let me break down a couple of things. So I've been going down this new grad and student PT rabbit hole on TikTok. I sent you a couple of videos. And one of the things that, recent grads, new grads, students, I don't think they fully comprehend. You said it when you said pattern recognition, whether we're talking clinical or personality. Like, we can generally understand the pattern of the individual coming in the door, talking to us on the phone pretty quickly, because we've got so many years of examples that have kind of confirmed. Now, do they establish a bias? Yes, 1,000,000%. I try to recognize my biases. I have them. I try to put them on a shelf, but I don't completely ignore them, because they do help guide clinical decision-making, business decision-making. And I think the true value between you and a new grad who might be just as clinically skilled as you is the fact that you can layer on these other deeper analyses of the personality. Even for you, like, we do this at times, we have done it, where you go on the property tax records, you see where they live, you see their house, you find all of this information. It's not just about saying, well, how much money can I charge? How can I maximize my rate? It's also about, who is this person? What can I expect? How can I kind of predict a little bit about what to expect from this individual based on the information I can collect?
What are they going to demand of me in terms of time or effort, and what are their expectations? I think all that goes into it. Yes.
Okay, so keep going.
So they said yes, and I was like, oh my gosh, I can't wait to tell Jimmy and Tony. That is crazy. So yeah, anyway, we're in the process of the table, the portable treatment table has been purchased and will be sent there. But part of that, about the impromptu boosting of prices and adding a monthly concierge fee, which I've always kind of thought about, whether annual or monthly. Um, but the caller was saying, well, because she was like, oh, you bring a portable treatment table, or whatever, and I was like, no, we don't, because we're, our therapists are in the subway and all that. And they're like, well, you were referred to us by so and so, and she's not going to get treated on a couch, or her bed, or a carpeted floor on a yoga mat. Those are things we usually say on the phone call, like, and we have some clients, by the way, that, like, they've been with us for like a year or two, and they're fine being on a carpeted floor or a yoga mat or their couch or whatever, and they're fine with not buying a portable treatment table, because some clients just don't want to have, they don't have the extra room for it. They don't want to slide it under the bed. They don't have room in a closet, whatever. And so this caller was, I said to you guys, almost like berating me about, like, and also saying, like, here's a tip to improve your business model for clients like us. And I was like, oh, I was like, wait till you hear the new pricing.
Yeah.
But
So,
the pricing didn't phase her. Yeah, go
in
ahead.
your own words, in your own mind, like, forget the sales part of it, forget the customer, forget all the other stuff. Like, how do you rationalize in your own mind why you would charge almost $1,000 a month fee on top of the per visit fee? Like, what does that allow you to do? What is the benefit, to the customer for paying a fee like that?
So directly, how I make sense of it is if a parent is calling in for their child, but the child is an adult, I already know in general, I'm generalizing. I already know the type of family and patient and the expectations that the caller, the parent, expects. They're going to expect like a lot of communication. They're going to expect, promptness of the therapist's arrival. So now it's like I got to tell my therapist, hey, like the client at this address, like you need to wear professional clothes. I know you always do, but I'm just reminding you, like you need to like be, your hair groomed and like you need to be prompt. You can't just be 30 minutes late and not text them. Like if you're stuck in the subway, you need to be texting the client. Like we need to be fully prompt on every aspect. So professional dress, arrival, expectations, that's with the adult client. But then the caller, the parent, might also want, I don't know, they might want some, weekly or monthly or whatever check-ins. So all of that takes time and effort, even if it's mine, even if the therapist is sending emails or texts or whatever to the parent. Um, the client is an adult, right? So I think I'd have to get like, and this is rare, but I think we'd have to get like a HIPAA release sign. I'm not sure because
Yeah.
they're an adult. So it's like you already like I already know I already can tell that I'm going to be not spinning a lot of plates, but there might be a lot of extra random admin requests and burdens and tasks and things to do. So you pitch this type of pricing because I've anticipated this. I've been in these homes before. I've treated both of these types of people before. I've treated the parent. I've treated the the son or daughter of this type of a parent. I know exactly what might be demanded of us, and I thought there might be some pushback on the price, and there wasn't. And I joked with you guys that like I didn't ask for enough money, haha. But
Yeah.
I think also this pay structure might also get their attention because when I happened to call the caller, when I called the parent, she was receiving physical therapy somewhere else. Like she was literally in a physical therapy visit.
Yeah.
So I also know that most likely that the physical therapist she was going to does not charge like we do. So that's another way to catch someone's attention. This type of a client, like they didn't say, she could have said to me, oh wow, that's more than my other PT elsewhere, because I know that physical therapist elsewhere is not charging 550 a visit and definitely not charging 950 per month as a concierge fee. So that's another thing that's kind of maybe you can elaborate more for me, because it's more of something that would like catch someone's attention like in this style. Do you know what I mean? Like
Yeah.
they would take us
Yeah.
a little bit more seriously.
You're speaking the same language, and I was just, again, I listen to a lot of media. I was listening to a public speaker yesterday, and she was saying how when she had her first offer to do a paid public speaking event, the company that wanted to bring her in said, how much do you charge? What's your fee? We want an hour. She said $500. And in her mind, $500 was unbelievable because she was used to making $50 an hour in a W-2 paid job. And she was like, I would have done it for free. So I thought, oh, I'll 10x what I make normally and charge 500. Then the story goes, the company chose not to hire her. And they went with somebody who was charging 5,000 for the hour. And then she asked them, why did you not hire me? And she said, well, truthfully, you were only charging 500. This person's charging 5,000. We're used to paying for, 5, 10, 100, even $100,000 speaker. We can't deal with a $500 speaker. And so just by speaking the language of a wealthy individual, they don't understand those rates. Like why would somebody who I expect to be premier, best in class, top of the line, why would they be charging so little? So you kind of have to get into that world. And then of course, once you get there, you start to realize, oh, these zeros don't really have the same impact to them as they do to me. If anything, an extra zero just means I'm that much better, and so I think that's a huge barrier for so many clinicians because so many are struggling day to day to just pay their loans. Like they can't even fathom an extra zero or two on the end of what they're used to making. So I think it's awesome. And like you said, I think the whole idea behind that kind of monthly fee is it just builds in the cushion to allow you to deliver what the client actually wants. These aren't individuals that are looking for government-funded healthcare. These are individuals that have the means and the resources to get what they want well beyond what government-funded healthcare is designed to deliver. Let me pull this up real quick because this is still kind of in line with what we were talking about. This, I'm going to share it. Let's see, share this instead. And let me pull it into the screen. This was shared, I know it's small, but I'll read it, in the Doctor of Physical Therapy students group. And I think this kind of goes along with the same idea. It says, hello, I'm writing out of curiosity and insight, a couple years out of PT school, working in an outpatient orthopedic setting since graduating. I was curious if anyone has any previously worked in outpatient ortho, and they've been thinking about switching into home health. I guess the main question is, has anyone been in the same boat, made the switch? What's your take, your experience on the decision? There's that, but before you answer that one, the other one, I'm going to share it. Let's see if it's showing. Yeah. This one says, recent grad, got extended a job offer in a cash-based practice. So one is an ortho PT thinking about going to home health, really because it pays more. The other one is new grad getting an offer from a cash clinic. Following successful interview process, the clinic owner, I was asked to provide a desired compensation. So first question, Dave, in negotiation, they always say, don't put the first number out there. Let the other party put the first number out there. But this person saying the clinic's hourly rate is $240 an hour. I'll be responsible for attracting patients and managing my own schedule. The clinic owner has agreed to cover malpractice, EHR, utilities, which I thought that was weird, and other expenses. They're also offering a retirement plan, health insurance. What do you think would be a fair compensation package for me to request?
All right, which one do you want me to hit on first?
Let's do this one because this one's more in your world. Like, what would they be looking at?
You want a dollar amount?
Like, just it could be a dollar amount. It could be, hey, if this practice is billing $240 a session, like, how do you even go about figuring out what you would charge?
If they're being paid hourly,
it didn't say whether it's hourly or being paid per session. I'm going to say they're probably offered a per session rate because it says they're responsible for attracting patients and managing their schedule.
There's no, I don't agree. There's no way. I know this is anonymous, so we can't even ask the person because they wanted to post anonymously. There's hardly any practice. I don't even care if they're cash based. If you're a cash based practice, you are not really relying on your staff physical therapist to attract new patients. So I don't think that that is a thing. I don't even like. I don't know.
Why do you say that?
Because if there's a cash practice out there, they've already, and if they're hiring, that means they typically have already figured out the marketing. They already have a customer client base. For me, Tony, like when I hire new therapists, they're not doing marketing. I want their calendar to be open and available for evaluations and follow-up visits. They can't get busy unless they do evaluations. I'm not sending them out I've considered it. I thought about it. I have some therapists that have asked about it, like, oh, do we have to do marketing or whatever? But no, I put that in my FAQ document that I send to every potential candidate. That's like 7 or 8 pages long. And I'm like, read this once or twice, and then we're going to talk for the first time. Like when we're messaging, or I message someone on LinkedIn, and in that 7-page document, one of the lines is like, one of the questions, the FAQ is like, do I need to attract and do marketing for new patients? Question mark. And then my reply is, no, we do the marketing. We're the business. That's our responsibility. We're the owner. That's our responsibility to be the PT Barnum, to drum up business. That's your responsibility, Tony. You know that. So the fact that this says that the new grad team member is responsible for attracting patients, what practice anywhere is making their employees go drum up new business? That's insane.
I
There's
don't
no
think it
way.
is. I really think there are a lot of smaller cash-based practices that expect the therapist to attract more patients. Now, I'll tell you the typical example. Usually what it is these are operating out of CrossFit gym or fitness facility or yoga studio or Pilates. They want their therapist, and I see this in personal training also. They want the therapist to go connect, network, make connections, and bring business in. I think these business owners think the value prop is, I've got the platform, you go out and get customers, bring them in, and we'll do a 50-50 or a 60-40 split. I think they think their business is so amazing that they shouldn't have to do their own recruiting and marketing and stuff like that. That a therapist who's so lucky to come work for me, it's your responsibility to go do it.
Okay, let's unpack this a little bit more.
Bo said there's a few like that in Colorado.
Who said that? Bo?
Bo.
That's crazy, man. Okay, well, it's a new grad. It says, hello, I'm a recent graduate. That
Yeah.
means respectively, because we all were there. And man, Tony, can you imagine my ego in the first 1, 2, 3 years out of school? I thought I knew everything, and then I realized whatever that the quote is, like, you realize how much you didn't know or how much you don't know. So the first couple years out of school, like, you might have a little bit of an ego, like you had rotations and you think you can fix any injury and all that, and maybe you do have great clinical skills, but as a recent grad, you're going to also require some coaching, some support. You're going to get a case, you're going to get a diagnosis, a presentation in front of you, and you're going to have no idea what to do. You're gonna come out of the evaluation and be like, I don't know, I had to blur, I don't know what just happened, and I don't know if I even made a dent in their situation. So real quick, so the clinic rate, they're charging $240 a visit. If the new grad is pulling clients from CrossFit or some other, running club, or they're bringing in patients to be treated there, then I agree with you, Tony. I think maybe like a 50-50 split per hour. So the new grad therapist is making $120 an hour if you're doing a pre-tax 50-50 split on that. If the cash practice is supplying the new patients, the marketing and the malpractice and the EMR and the overhead of the practice and all that, then we're talking like 25 to 33%. We're talking about $60 to $80 per visit if a cash practice is charging 240, because ideally that would be a sweet spot. Like, the therapist is then making 25 to 33% of the top line revenue of the 240 per visit. So it depends on the marketing. If you're a practice owner out there, if you're watching this and you are making your team members attract new patients, you're teaching them how to be a business owner, and they're going to leave you and they're going to take all these patients from you. So please just go learn marketing. Go watch Alex Hormozy videos. Go watch Tony Maritato. Learn Medicare billing on YouTube and learn more about marketing. What's Bo saying here?
Clinician gets about 44%. I agree with Dave. I think 33% at the top level, if the business is bringing the client. If the business is bringing the client, 33% top level is totally reasonable. That leaves a third for profitability. That leaves a third for covering expenses and overhead. 44%, now you're starting to step into that therapist better be an asset to the business. That therapist better start building a book of business
Yep.
that they're kind of, consistently their clients are not canceling, not no showing, completing plans of care, all of that kind of stuff. But for a typical kind of, I'm a good enough therapist, I can get my patients better, my patients don't hate me. 33%, I think, is where you pretty much top out.
Right on. Agreed.
All right, we're at the 9:30 mark. Let's do parting shots. So I'll go, and then Dave, you go. I'm gonna say the biggest theme from today is understanding the balance between the business of physical therapy and the treatment, the care, the other side of physical therapy. We're all going to change. We're all going to go through evolution. I spent a lot of my 25 years focused on the patient care. It was all about the patient care. I'd go home and research. I'd read studies. I'd learn things that I didn't know. If I had a case that I didn't understand, like everything was about the patient. Now I've kind of moved past that to my passion is the business. I love the business. I love the systems of the business. I want to make the business better to support other clinicians who are more interested in focusing on the patient at this point. Doesn't matter where you are in the journey, just understand where you are and, put your time and effort into what has the greatest impact. Dave, what you got?
Love it. If you're watching and listening this far in, if you're a physical therapist out there that wants to make $100,000 and treat 4 to 6 patients per day, call us, reach out, find me. I'm easy to find on the internet. Send me an email, apply. We would love to speak with you. If you're a practice owner out there, it doesn't matter if you're in network. We do prefer a little bit more of the out of network cash pay models. But if you're a practice owner looking for a transition, looking for a buyer, we have practice owners reaching out to us all the time, whether they have a broker or not. If you're looking to sell 60, 70, 80% of your practice and then keep some of the upside while we grow it, reach out. If you're looking to get out 100% and you're looking to sell and go on to the next chapter of your life, reach out to us at the Fieldmaker Group or send me an email. Find me again on LinkedIn or on the internet somewhere. And that's it for me.
All right, guys, come back and see us Tuesdays, Thursdays, 8:30 a.m. We'll catch you.
Hi, my name is Karen, and welcome to the PT Breakfast Club podcast.